Hello everyone, myself Dr. Tapas Pal and welcome to our channel PhysioMax organization. As we are continuing our medical education, today we will see a classical X-ray where the patella is maltracked, and with just a AP and a lateral view, how easily we can see the patellar maltracking. Just have a brief that what happened to a patient. The patient was abdominally normal and walking on a street and suddenly had a twist of the knee, and resultant she had a tremendous pain on the knee. In the X-ray it came bit normal as per the radiology, but a orthopedic point of view, when we saw the X-ray, there is a huge lateral shift of the patella. And the shift of the patella not only lateral, it's a superior lateral, and that's what we can tell as a patellar alta also. So let's see how the X-ray looks like when we will be seeing the X-ray in a V-box. As we are talking about the X-ray, and this is what's the view of AP, and this is what's the view of lateral, and this is the right side X-ray, and this is the left side X-ray of the patient. And what we are seeing over here, as we can see in the AP view, we can see a bit shadow over here. Normally this is the femoral condyle as it's seen from the posterior aspect. These are the femoral condyles, and we can see a shadow of patella over here. Normally the patella needed to be sit in between the intercondylar groove, but as per this X-ray what we are seeing over here, the patella is maltracked. The patella not only maltracked laterally, the patella shifted bit superiorly also. So by seeing this X-ray we can diagnose this condition as a lateral patellar maltracking with superior upliftment. This was what exactly tell as a lateral patellar maltracking. If you compare the right side leg with a left side leg, where we cannot see any of the shadow over here, that denotes, and we can see the hyperintensed patella over here, so that denotes the patella did not shift for the left leg, but the patella it's bit shifted on the right side, and that's what is the lateral patellar maltracking is. Now if I guess and if I make you understand the lateral view of the X-ray, if we see the size of the patella, this is the again right side of the shifted side, and this is was the left side as the normal side. If you see from the left side, the patella it looks a bit larger in comparison with the right side patella. It is just because the right side patella it's shifted and the left side patella it's in normal position. So how to calculate this? If I just make the pencil mark over here, this is the side from the left and this is the mark from the right. So the right side patella looks bit small in comparison with the left side patella. Again, this view and these things are seen only in the X-ray. So with the AP and the lateral view, we can easily find out the patella is maltracked or not. What we understood from this X-ray is, with the AP and the lateral view, we can find out the lateral patellar maltracking with a superior shift. But normally to understand the patellar maltracking, the needed X-ray is needed for a skyline view, where the knee is flexed more than 60 to 70 degree, and the transversely the X-ray beams are passed to take the X-ray, where we can easily understand with the skyline view the patella is maltracked or not. Most of the times these conditions are misdiagnosed in the field of orthopedic and the sports injury, and that makes the pain to intolerable, and in the late stage this type of patellar maltracking will make patellofemoral arthritis or patellofemoral osteoarthritis. That's the reason we need to aware patients that whenever there is a small amount of injury, you need to be consulted with your physiotherapy doctor. They are the person who will identify the patellar maltracking and who can bring back the patella to its own position. Understand that there are no medicine, there is no other treatment rather than physiotherapy which can make the patella on its own position. That's the reason we need to identify the injury first. We need to identify the cause of the injury and we need to diagnose the condition before we start treating any sort of pain for a patient. That's what about today's education, and in the next video again we'll come up with some new radiological view to make you understand. Thanks once again to watch this video, and those who are new for this channel, don't forget to subscribe the channel. Thank you.